One of the youngsters who took part in that trial, 16-year-old Tom Baragwanath, along with his mum, JOANNE, and Dr. Pamela EWAN, who has been leading the research, or helping lead the research. Very good morning to you. Well, let's start with you, JOANNE. When did you know that your son had a peanut allergy?
He was about 2 years old. I gave him a little bit of peanut butter on toast as a snack, and he had a reaction sort of almost immediately. Mouth started swelling, his fingers where he touched it, and yeah, so it was since he was that young.
Yeah. So what did you do after that? Did you know straight away it was peanuts? Did you work that out?
Yeah. Yes.
So you just
it was immediately as you know, as he had it. It happened. So
for a period of time you just didn't have peanuts in the house, or didn't?
Yeah. No, we have not had peanuts in the house at all.
But you have two other children who don't have a peanut allergy.
No, the other two are fine. They're younger than Tom, but no, they're fine.
Of course, Dr. Pamela EWAN, the trouble with a peanut allergy, it is potentially fatal, isn't it? And so for a parent, or for anyone who suffers, it is quite a concern, and which is why this research is so exciting.
Yes, it has a huge impact on quality of life, and people are afraid all the time. Every time your child or you are having a meal, you have to think about it, and you're taking a risk. Are there peanuts hidden in this? And so peanut is the most common of the foods to cause these very dangerous and fatal reactions.
Take us through the story. So you're 16 now.
Yeah.
You come to the trial, what, 3 years ago this is?
Yeah.
Had you eaten any peanuts in that before then?
No.
OK, so you're going to this trial and they are feeding you the one thing that you know you're allergic to. What was that like, sort of psychologically? Was that difficult?
I was a little bit worried to start off with, but everyone at Addenbrooke's was so nice and helpful and kind, and so I wasn't really worried at all because I trusted them, basically.
And it's a slow process, so initially very small quantities.
Yeah, very small.
And did you have any reaction at all? What happened?
Occasionally my like mouth and tongue and stuff would start itching, but I never had any serious reaction at all.
And then gradually the dosage is increased. So you're monitoring very closely. So you're watching Tom, and he initially has some reaction.
Not necessarily, no. Some patients don't have any reaction, but there is a possibility of reactions, mostly mild, while we're increasing the dose, yeah.
Had all of the patients shown a reaction because they'd previously eaten peanuts? You knew that they all would react if they had peanuts?
Exactly. So at the start of this trial, before they enter, they have what we call a challenge test, which shows at what level, and it's really often tiny amounts of peanut. So what is really astonishing with this is that we know how allergic they are to begin with, and at the end we can test them with 5 peanuts, with 10 peanuts, and they can tolerate these amounts.
You have quite an extraordinary success rate, I think about 85% successful. Now, what does that mean? What are those young people having to do, and what are you preventing happening?
Well, once they've been treated, it frees them up from this anxiety. They can eat foods, they don't need to check ingredients. It makes a huge difference to their lives, and basically it makes them safe.
And in terms of treatment, what are they having to do continuously? Are they having to eat peanuts regularly in order to desensitize themselves?
Yes. So what happens is until they're eating 5 peanuts a day, they then carry on eating the equivalent of 5 peanuts a day. That's this research, and that shows that the majority are able to do that. We then have got some other patients who we did in an earlier pilot study who we've followed up for much longer, and we know that we can give them peanuts less frequently, and we're gradually working it down.
So Tom, on a day-to-day basis, I mean today for example, how does it work?
Well, I just in the evenings, just after my tea, I'll just have 5 peanuts and then just eat them, and then next day do the same.
Well, you must be thinking, I mean, I don't know, all those years of worrying about packed lunches or going to school, and I mean, you must be thinking, we should have known about this sooner.
It's brilliant. It's so much better now. Obviously, when he was growing up at school, he couldn't sit next to people at lunch times in case they had peanut butter in their lunch boxes, and we can go out for meals.
Doctor, can I just ask, quite a few people got in touch this morning saying you know, 20, 30 years ago, they knew about this approach, you know, have a little of the thing that you think you're allergic to as some kind of treatment. The notion has been knocking around for a while, hasn't it? But the first time it's been officially tested, is that
Yes,
right?
this is a first in food allergy, and peanuts is the first food we've been able to do this. Yes, you could do it for hay fever, you could do it for bee stings, so the principle is established, but it hasn't been done in peanut before.
And presumably, you know, down the line, it'll be a tablet that you can provide for people with this allergy.
It might well be, but people mustn't be trying this on their own. And it's got to be done carefully, under clinical conditions, in hospital. It's not something to try yourself.
And for 15% of the children or the young people involved, it didn't work.
That's correct, but it's such a high success rate. Most treatments don't do anything like this, so it's a huge benefit and a great success.
It's fantastic news. Dr. Pamela Ewan, thanks very much indeed, and to Joanne and Tom, thank you.